Hello people, in this video let us look at this Courvoisier's sign. Courvoisier's sign. Basically you have a patient here who has jaundice. Let us say you think he has obstructive jaundice. Means there is a block. Okay, where is the block? Let's look at this image here. So let us say there is some blockage to the flow from the liver and the gallbladder into the intestine. So what will happen? All the conjugated bilirubin will be produced by our body. All the liver's job is to conjugate this bilirubin, right? So lot of conjugated bilirubin accumulates in this person and he has jaundice. Okay. Now this jaundiced person comes to you and you are palpating to check whether this guy has any obstruction because of it. Just the jaundice has happened. Okay. And now what happens? You find that this gallbladder is palpable. Okay, the gallbladder is palpable. So what they're saying is if gallbladder is palpable, that means it does not contain stones. That's what they're saying. That means if there is gallbladder which is palpable, you can say that the obstruction is not because of stones. Because why they are saying is if the gallbladder has stones, it will have, the gallbladder will shrink, it will contract, fibrosed it will become. Okay. So this is very interesting. When you think that there are stones inside, you will think you can actually palpate it, right? That's what you and anybody would think. But what they are saying is you can palpate the gallbladder. That means the cause is not the stones, gallstones. That's what they are trying to say. Okay, this is the Courvoisier's sign law. Look at this. So that is what the sign is. So in obstruction, this one. In a jaundiced patient, if the gallbladder is probably enlarged, then the obstruction is not because of stones. Okay, it doesn't. So the jaundice itself, they are saying, is not because of stones. Okay, that's what they are trying to say. Whether it's obstructive or whatever, the jaundice definitely is not because of the stones. Okay. So this is the rule. So if there is obstruction because of the stones, then you cannot feel the gallbladder because the gallbladder will already have shriveled, fibrosed, contracted. Okay. Then why is this rule important? Just to rule out gallbladder? No, it's not to rule out gallbladder. What they are saying is if you can feel the gallbladder, okay, and you're still suspecting that there is an obstructive jaundice in this guy, then be very careful. It could be because of the pancreatic cancer. Okay, this pancreatic cancer, head of the pancreas especially, or it is because of some other carcinoma here, which could be of the ampulla, or because of the some common bile duct issues. That's what they're trying to say. So you should be careful that if you can palpate the gallbladder, then it is not because of stones. There is some other serious cause. That is what the textbook says. That's why this Courvoisier's sign is very important. If in a jaundiced patient, if the gallbladder is probably enlarged, palpably enlarged, then it is not the gallstones which is the cause of the jaundice. Okay, jaundice can be because of so many things, right? Pre-hepatic, hepatic, post-hepatic. But if you're suspecting that there is an obstructive jaundice, then the obstruction definitely is not because of the gallstone, some other cause. Okay. There are some exceptions to this Courvoisier's law. Look at them. Yes, there are some exceptions to this Courvoisier's law. Basically, if there is double impaction, that is, if there are stones in two places, that is in the common bile, in the cystic duct and in the common bile duct. Okay, there are stones in the cystic duct and in the common bile duct. What will happen? This gallbladder, of course, would have fibrosed and small and all that. But what will happen? It will contain mucocele, become mucocele, and it will have mucus and it will become palpable. Okay, so still the gallbladder will be palpable, yes, because it is a mucocele. But the stones are the cause of the obstructive jaundice. So that's what they're trying to say here. That's an exception. Okay. Similarly, in cholangiohepatitis, also the gallbladder will be normal. So you can feel it, but the stone will be there in common bile duct. Okay. So that's what they are trying to say. One more condition they are saying is cholecystectomy is done and this person has a periampullary carcinoma. So would you probably feel the carcinoma and you will think that it is the gallbladder? Because this one is not clear. It is not at all a stone, at least that's what it looks like, but there is a periampullary carcinoma, but you can palpate something looks like, right? So you will think that it is the gallbladder. So this is exception to the Courvoisier's law. Okay, so that's what it looks like at this moment. So if you have any improvements to this, please let us know. This is our understanding of this Courvoisier's law. Okay, fine. Bye bye.